tell you viva question regarding lung. The examiner will ask you, what is this? So this is lung tisra. Where it lies? It lies inside the thoracic cavity by the side of mediastinum. From C7 to C10. ठीक है? Apex of lung C7 हो जाता है. ठीक है? Now tell me the texture of lung. So it is porous, elastic and crepitous. Porous, that there are air cells in between. Elastic, that it stretches. Crepitous, it produces crackling sound on touch. So it is porous, elastic and crepitous. Okay, now tell me why this is black. Why lung is black? Due to the deposition of inhaled carbon particle. What is the medico-legal importance of lung? Even with a, now you have to tell, even with a single breath, this lung will expand and it will float over the water. But in case of a stillbirth, who has not taken even a single breath, it will sink down. That quality of lung is used for the medico-legal purpose. Now tell me the covering of lung. It is pleura, a double layer serous sac. One layer which is adherent with the thoracic wall is the parietal pleura, and one which is adherent with the lung substance is the visceral pleura. Okay, what is the amount of the pleural fluid inside the pleural space? It is 1 to 2 ml, but it can go up to the 8 to 10 ml. It's normal. Okay. Now, tell me the surfaces of lung. It has got costal surface, medial surface, inferior or diaphragmatic surface. This is inferior or diaphragmatic surface, and apex. The surface, costal surface, lies against the ribs and intercostal space. Medial surface is towards the mediastinum, and it is divided into large anterior mediastinal surface and posterior small vertebral surface. Apex, which is conical, and it faces superiorly. And there is diaphragmatic surface, which lies over the diaphragm, and it is concave. Now you tell me of which side it belongs to. Tell me the side determination of lung. So you have to tell that side determination depends upon the borders and surfaces, not over the about the lobes and features. So for side determination, there are three things are essential: anterior, posterior, medial, lateral and superior, inferior. So anteriorly there is thin and well marked border. So this is anterior border. So anterior, this is anterior, and posteriorly there is wide broad border. So this is posterior. Convex surface of the lung should face lateral, and the surface which bear the hilum should face medially. So this is medial and this is lateral. Conical part should face above, and the concave part should face downward. So this is superior and this is inferior. So this is of right side. This is how you can determine the side of lung. Now tell me about the difference of right lung and left lung. You can memorize easily by that right lung. We can imagine that right lung is husband and left lung is wife, because husband is always right. So right is so right lung is husband and left lung is wife, because she always gives threatening to leave the house. So left lung. ठीक है? Yeah. रखने के लिए, लाइफ लॉन्ग याद रखना. So although they live together, but there are differences as long as wall of China. So wall of China. Now W for weight. Obviously, right lung is husband, so it is heavier. So 700 gram and left lung is 650. A for architecture, that it is somewhat broad and thick. And left lung, like the wife, slim trim, thin and long. Thin and long. Okay? Now, L, that wall of China. Lobe. In the right side, there are 3 lobes. That's superior, inferior and the middle lobe. And in the left side, it is only 2. That is superior and inferior. Wall of China. There is nothing from O, it is F. So fissure. In the right side, there are 2 fissure. That is, this is oblique fissure and this one is horizontal fissure. And in the left lung, there is only 1 fissure, oblique fissure. Of China, CH. CH for characteristic feature. That in the right lung, this is artery, so this is epiarterial bronchus and this is hip arterial bronchus. Above the artery, this is epiarterial bronchus and this is hip arterial bronchus. Because in the right side, the bronchus divides before going inside the lung substance. It divides into 2. Even though it divides here also into 2, but within the lung substance. But it is at the hilum. So this is the characteristic feature. I for impaction. Right lung is more prone for foreign body impaction, whereas left lung less prone. Why? I will tell you later on. China, and for notch. That in the left side there is cardiac notch. This one is, here is the cardiac notch. Cardiac notch and tongue-like process below is the lingula. So cardiac notch and lingula. And A for artery. In the right side there are 1 bronchial artery and in the left side there are 2 bronchial arteries. In the right side, bronchial artery is the branch of posterior intercostal artery, whereas in the left side, bronchial artery is the branch of descending thoracic aorta. Because in the left side there is aorta, descending thoracic aorta. तो वो जिधर है तो उसको फेवर कर रहा है, इस तरफ एक ही दिया है bronchial artery, इधर 2 दे दिया. इधर posterior intercostal artery से निकल रहा है, इधर descending thoracic aorta से निकल रहा है. So these are the differences. And now the examiner will ask you, tell me the similarity of 2 lungs. So both lung has got 10 bronchopulmonary segment. Okay? And there is 2 pulmonary vein and 1 pulmonary artery in both cases. Okay? Now the examiner will ask you, tell me about the fissure. From where to where it extends. So, oblique fissure. It starts from 6 centimeter below the apex and run downward and outward like this and cuts the inferior border 9 centimeter lateral to the mid-sternal line. 6 centimeter below the apex, it starts from it cuts the posterior border and then although all the fissure it starts from hilum and ends at hilum. But it cuts the posterior border 6 centimeter below the apex and then it cuts the inferior border at 9 centimeter from the mid-sternal line. And tell me the extension of horizontal fissure. It starts from fourth costal cartilage, fourth intercostal space, not cartilage, fourth intercostal space, and where it cuts the oblique fissure is the horizontal fissure. Usually it is in the mid-clavicular line. Okay? So this much you have to tell. Now the examiner will ask you, show me the impression. What surface. So as we know, the right lung is in relation with the venous system and left lung with the arterial system. So in the right lung there is right atrium because superior vena cava, inferior vena cava all opens. So here is the impression of right atrium. This one is of right atrium. Here is the inferior vena cava. This is impression for inferior vena cava here. Ever the superior vena cava. And this is of right atrium. And there, here is also subclavian vein. यहाँ पे ये ब्रोंकोपल्मोनरी ट्रंक हो गया और यहाँ इसके इंफीरियर इंटरनल जुगुलर वेन हो गया, ऊपर गया और यहाँ सबक्लेवियन वेन निकला, तो यहाँ पे सबक्लेवियन वेन का भी इंप्रेशन पड़ता है. ठीक है, यहाँ पे नहीं है वेनस सिस्टम नहीं, माने इसको अगर करेंगे इस तरह से, यहाँ पे है जैसे ये है ना, वेनस सिस्टम नहीं है यहाँ. ठीक है, तो वो यहाँ पे सबक्लेवियन वेन का भी पड़ेगा. और इधर लेफ्ट लंग में यहाँ पे राइट वेंट्रिकल से ही निकल रहा है एओर्टा, तो यहाँ राइट वेंट्रिकल का इंप्रेशन होगा. ठीक, और उसके बाद यहाँ पे एओर्टा एंड पल्मोनरी ट्रंक. यहाँ ये हो गया असेंडिंग एओर्टा, आर्च ऑफ एओर्टा, डिसेंडिंग एओर्टा. ठीक है, फिर यहाँ पे हो जाएगा सबक्लेवियन आर्टरी एंड कॉमन कैरोटिड. सबक्लेवियन आर्टरी एंड कॉमन कैरोटिड. और यहाँ से हो गया पूरा आर्च बन गया. और यहाँ पे भी एक आर्च है, आर्च ऑफ जाइगस वेन. ठीक है, यहाँ पे भी एक आर्च जाएगा ऐसे, आर्च ऑफ जाइगस वेन. राइट लंग में कौन सा आर्च? आर्च ऑफ जाइगस वेन. लेफ्ट लंग में आर्च ऑफ एओर्टा. और पोस्टीरियर एस्पेक्ट में यहाँ पे भी देख रहे हो कि ये इंप्रेशन है, यहाँ भी इंप्रेशन है, तो आगे ट्रैकिया, पीछे ओसोफेगस. राइट लंग में भी और लेफ्ट लंग में भी. फिर there is relation, not the impression, of phrenic nerve and vagus nerve. Phrenic nerve runs anterior to the lung root, whereas the vagus nerve runs posterior to the lung root in both. Also, in the left side, there are two more things, that is thoracic duct and left recurrent laryngeal nerve. There is relation of two more things on the mediastinal surface. The examiner will ask you, tell me the two things that is in addition in relation with the mediastinal surface of left lung. Then you have to tell it is thoracic duct and left recurrent laryngeal nerve. Left recurrent laryngeal nerve is the branch of vagus nerve. Right and left both. So it is very important. Mediastinal surface, right side venous system, left side arterial system. So there is right atrium, inferior vena cava, superior vena cava, subclavian vein. Here is the right ventricle, ascending aorta, arch of aorta, descending aorta, common carotid artery, subclavian artery. Arterial system only. Here is the venous system. On posterior aspect, anterior trachea, then esophagus. These are the impression. Now relation. Anterior to the lung root, phrenic nerve. Posterior to the lung root, vagus nerve. Two additional things in the left side. Left recurrent laryngeal nerve and thoracic duct. These are all about the mediastinal surface. Now examiner will ask you, what is this concavity? Why this is so? In the right side and left side? So you have to tell, in the right side this concavity is due to the right lobe of liver, and in the left side it is due to the fundus of stomach, spleen, as well as a little bit of left lobe of liver also. Okay? Now tell me the parts of pleura. So on the apex there is apical pleura. On the costal surface, this is costal pleura. Mediastinal side there is mediastinal pleura, and on the diaphragmatic surface there is diaphragmatic pleura. Tell me about the borders of lung. So it has got anterior border, which is well marked and thin. Posterior border, which is broad and thick. And inferior border, which is semilunar, moon-shaped, semilunar. Tell me, the anterior border occupy which space and inferior border occupy which space? So anterior border occupy costomediastinal races, whereas the inferior border occupy costodiaphragmatic races. Tell me the races of lung. It is the dead potential space. Dead, that it is not in use, and potential when needed can be used. So it is two CM races and CD races, costomediastinal races and costodiaphragmatic races. Costomediastinal races, that it is the costal surface and it is the mediastinal surface. In between these two, and it is well marked on the left side at the level of cardiac notch. Because this is lung and pleura is excess. At the region of cardiac notch, lung is absent, but there is pleura, and that form the races. What is costomediastinal races? And costodiaphragmatic races where the inferior border lies. In between the costal pleura, right, I am talking about the parietal pleura, costal pleura and diaphragmatic pleura. Costodiaphragmatic races. Okay? And this is the most dependent part. When pleural effusion, the fluid will settle down there. Okay? And tell me any significance of costomediastinal races. So it will present even a little bit, even a 5 ml extra fluid is added in case. So in knee chest position, there is one घोड़ा घोड़ा बच्चा लोग खेलते हैं ना, नी एल्बो पोजीशन, तो वो उस पोजीशन में करके अल्ट्रासोनोग्राफी नीचे से करके तो वो पता चल जाता है कि वहाँ पे उस रेसेस में कॉस्टोमेडिएस्टिनल रेसेस में फ्लूइड सेटल डाउन कर जाता है. तो इवन 5 ml ऑफ फ्लूइड तो अल्ट्रासोनोग्राफी से 100% एक्यूरेसी से पता चल जाता है. ठीक है, तो वो उसका खासियत है कि इनिशियल स्टेज में बता देता है. एंड कॉस्टोडायफ्रैग्मेटिक रेसेस जो डायफ्राम की तरफ है, ठीक है, उसको वो मोस्ट डिपेंडेंट पार्ट है. वहाँ जाता होगा तो वो स्टैंडिंग पोजिशन में वहीं पे जाके चला जाएगा. ठीक है. Now the examiner, very important, examiner will ask you, tell me the arrangement of structure in hilum. It is bhab, antero-posteriorly bhab. That there is vein, this is vein, bhab, then artery and then bronchus. This is vein, this is artery and this is bronchus. And supero-inferior inward ABV, artery, bronchus, inferior pulmonary vein. Antero-posteriorly bhab, that superior pulmonary vein, then artery and then bronchus. How will you identify that this is vein and this is artery and this is bronchus? Due to its texture, that vein is thin and collapsible. Vein is thin and collapsible, whereas the artery is thick and elastic. Thick and elastic, whereas the bronchus is hard and cartilaginous. This much you have to tell. Vein is thin and collapsible. Artery is thick and elastic, whereas the bronchus is hard and cartilaginous. Show me the lobe of azygous vein. So this much from here, the arch of azygous opens into the superior vena cava. So this much part is, it seems like it is one lobe. Give a confusion of a lobe. So that is, this is known as azygous lobe or lobe of azygous vein. But in 1% cases, ये यहाँ से जो जा रहा है azygous vein, वो इतना अंदर रहता है कि यहाँ पे एक फीसर सा बन जाता है, फॉल्स फीसर. इसमें वैसा नहीं है, तो ये 1% वाले में नहीं आ रहा है, लेकिन यही होता है यहाँ पे, ये ऐसा हल्का है यहाँ, ठीक है। नाउ टेल मी द वेरी इंपॉर्टेंट, टेल मी द inferior limit of pleura and lung. So inferior limit of pleura is 8, 10, 12. प्लूरा क्या है, ये एक अगर मान लेते आदमी है तो ये जो शर्ट पहना है वो प्लूरा है, तो शर्ट तो बड़ा होगा ना, तो 8 इन द मिड क्लैविकुलर लाइन, 8 इंटरकॉस्टल स्पेस में, 10th इंटरकॉस्टल में मिड एक्सिलरी लाइन एंड 12 इन द मिड स्कैपुलर लाइन, 8, 10, 12. एंड नाउ इंफीरियर लिमिट ऑफ लंग इज 6, 8, 10, दो कम कर देना है। So in the mid clavicular line, lung is up to the 6th intercostal space. In the mid axillary line, lung is up to the 8th intercostal space, and in the mid scapular line, it is 10th intercostal space. So another question will be, at which side you will do pleural tapping? If there is a patient of pleural effusion, you have to do pleural tapping. At which side you will insert the syringe to pull out the excess fluid. So it is from 8 to 10. 8 to 10 in the mid axillary line, where lung is absent, only pleura is there. In the mid axillary line, from 8 to 10 intercostal 8 to 10 intercostal space with full expiration. इंस्पिरेशन का तो लंग नीचे आ रहा है ना, एक्सपिरेशन में और ऊपर चला गया, तो और सेफ्टी हम लोग ले लिए, इतना बोलना होगा। At which side, the examiner will ask you, at which side pleural tapping is done. So pleural tapping is done in 8 to 10th intercostal space in the mid axillary line with full expiration. Okay. Tell me the relation. Only this one. Tell me the relation of structure on the posterior aspect of apex, apical pleura. So you have to tell it is Swati. That's sympathetic ganglia, posterior intercostal vein, A for posterior intercostal artery, and T1. T हो गया ना Swati. T1. तो T1 intercostal nerve, first thoracic nerve. तो ये यहाँ पे posterior है, ये भी पूछा जाता है कभी कभी. So this is about the lung.